Hello, this is going to be the introduction to our transitions of care activities. So this is Dr. Cieri-Hutcherson. I'm going to be talking to you first about transitions of care activity number 1. So this is going to be the first of a 3-part series, so there'll be transitions of care activity 1, 2, and 3, and they all kind of follow a patient throughout their inpatient stay. So transitions of care activity number 1 is going to be focused on performing an accurate medication history when patients come to the hospital, and then also completing an assessment on a patient that's coming into the hospital to determine if they will require some more detailed discharge documents, such as a detailed medication list or a pharmacist to perform a follow-up phone call. So that's transitions of care activity 1. As you'll hear for transitions of care activity 2, that's going to be more on the discharge side, so we'll do activities related to discharge counseling, and then transitions of care activity 3 is going to be following the patient after they've been discharged with a post-discharge phone call. So the first one, transitions of care activity 1, if you go to UB Learns into the weekly course documents and instructions and click on week 4 and 5 transitions of care activity 1. There's a class plan there that pretty much outlines everything that we will be going over in the video. So you're going to be reporting to 250. There's going to be a very specific schedule of times that students are going to be going into different rooms with the TAs. That will be posted at a later date. So because this is a professional activity, professional dress is required. So make sure you review the goal of the activity before you come in. But basically, as I said before, you're going to be performing an accurate medication history on a patient that comes into the hospital. And then on a second patient, you're going to be performing a transitions of care assessment to determine whether or not they should require a detailed medication list or maybe a simple one, and whether or not a pharmacist should perform a follow-up phone call when the patient leaves the hospital. So a lot of the transitions of care activities come from data related to the ASHP and APHA Medication Management and Care Transitions Best Practice document. So if you click on that, it's kind of a large document, but what it has in it is from ASHP and APHA. It has a number of different examples of care transition processes that are in place at different hospitals. So you can look through some of those. But in terms of the class, things to look at first would be, what are care transition models? How are they involving pharmacists? And then if you scroll down to page 4, some of the elements for success are highlighted there. So multidisciplinary teams, how to integrate the pharmacist team, and the available data that justifies having a pharmacist or having resources be involved in care transitions. So I know it's a large document, but if you just kind of read through and review the first 5 pages or so, and then if you're interested, you can scroll down and see some of the examples of best practices. So that's listed on UB Learns for your reference for all 3 care transitions classes. So you can read that under each one. Again, the student-specific schedule will be posted closer to the time of class. So if we go back to the class plan, students will be reporting to 250 at their group time, so they'll be going into 2 different patient interactions. The first patient interaction is going to be where you perform a medication history on a patient. So this is extremely important when patients come into the hospital, because a medication history helps the provider determine which medication should be continued, which should be stopped, and they perform a reconciliation with the home medications and the current active inpatient medications. So they look at what the patient was on at home, and they have to decide whether or not to continue those things. So an accurate medication history is really important, and pharmacy can be a key player in this step in the process. So what you're going to do is you're going to have access to a medication history form. So here's an example of the form. You don't have to print it because you'll be provided it in class. When you go into the room, you'll be able to fill in the form by filling in the patient's name, med rec number, height, weight, other demographics. You want to always make sure that you collect the patient's pharmacy's name and the pharmacy phone number. So if the patient doesn't know all of their medications, you need to have a couple other resources of how you're going to obtain that information. So the patient's outpatient pharmacy is going to be one of those resources. What you're going to do after that is you're going to go through with the patient what medications were they taking before they came in. So you want to ask about prescription medications, record the drug name, dose, route, frequency, the indication, when they started it, how long they've been on it, and the last dose and time. These are important in an inpatient setting because it helps determine for the inpatient pharmacist when they should start that medication. So for example, if a patient's on warfarin every day and they've already taken their dose for the day, then you wouldn't want to start the inpatient warfarin until the next day. So that's why you want to know when the patient last took their dose. Determine whether or not you think it should be continued, and then leave this last column blank. The physician or provider would be filling that out. So you're going to fill this out for any prescription medications that the patient's on. You're going to also fill this out if the patient has any over-the-counter medications and also any herbal products. So make sure to specifically ask about prescriptions, OTCs, herbal products, anything scheduled, anything PRN, and fill out the chart. So again, ignore this last column. This is what the provider would use to determine whether or not they would actually continue it on an inpatient basis. You can make your recommendation of whether or not you think it should be continued. As you get to the end of the form, make sure you record any allergies or intolerances that the patient has, where you got your information from. So did you get it from the patient? Was it a family member? Did you call the pharmacy? And leave your notes there. Then make sure that you fill in your name, sign, date, and time. You would leave the prescriber information, name, signature blank. So that's the first patient interaction. So you'll be in front of a TA playing a patient, and they will give you this information for your first form. So again, you don't need to print this out. It will be provided to you. The second patient interaction is going to be a pre-discharge transitions of care assessment. So again, the example is here, but you don't have to print it because it will be provided for you when you're in class. You're only going to be performing this on one patient. This is just here twice. If you make any mistakes or if you need to fill out something differently, then you can just cross out one of the copies. So we'll just focus on the one side. So in a transitions of care assessment, this is when the patient's getting ready to leave the hospital, and they should have an assessment completed to determine what should we be doing as part of our discharge process. So it's an assessment with the patient to determine, do they need, just a simple medication list when they're leaving the hospital, or do they need something more detailed, and should a pharmacist be following up with them after they leave? So this assessment can be done. You, again, just basically fill out the patient's name, other demographics, obtain their primary care physician's name and phone number, because this is going to be one of the people that they're going to be following up with as an outpatient. Then you just go through the questions with the patient. How sure are you that you need medications to treat your health problems? And then record whatever the patient has said to you. How sure are you that you can take your medication every day as prescribed when you are home? When you are at home, how often do you skip doses of medication or stop taking your medication? How difficult is it for you to pay for your medications? And the fifth question being, how often do you experience adverse effects from your medications? So check the appropriate boxes based on your patient's response, and then calculate a score out of 5. The other things that you should be checking are whether or not the patient has congestive heart failure, or whether or not they have a transplant, a solid organ transplant. Every patient that has congestive heart failure will receive a follow-up phone call by a pharmacist, and every patient that has a solid organ transplant should receive a detailed medication list. So, congestive heart failure patients are at a very high risk of readmissions, and this is why they need close follow-up, especially when they leave the hospital. So that's why they need a pharmacist to follow up as a phone call. Solid organ transplant patients often have very detailed medication regimens that they have to maintain very strictly, so a detailed medication list is recommended for those patients. So make sure you ask about those conditions and then record those and any other conditions that the patient might have. So then, based on what you found, you would decide whether or not you would have a pharmacist call the patient once they go home. So anyone with a score greater than 2, anyone with congestive heart failure, or any other condition that you feel needs follow-up that you can justify in the comments should receive a pharmacist call after. Next, determine whether or not you would provide a detailed or regular medication list. So a detailed list for everyone with a solid organ transplant, and then other conditions if you justify it in the comments. And then the third being, should the pharmacist contact the patient's outpatient provider? So you would justify all of that in the comments section. Then, with your patient, make sure you obtain their phone number and schedule a follow-up phone call if you're recommending one. So if you recommend a follow-up phone call, the call should be scheduled within 72 hours. So if you determine that your patient is going to be leaving by 1 p.m. on that Tuesday, they should receive a follow-up phone call by Friday at 1 p.m. So make sure you put any comments of why you're going to recommend a detailed medication list, why you would want a follow-up phone call, or why the pharmacist should contact the primary. Put your name, signature, date, and time. If you would decide not to call a patient, for example, if they had heart failure, or even if their score was over 2, then you should justify that in the comments as well. So justify if you're going to call and if you're not going to call. So you'll be filling out those 2 forms. So you'll have 2 scheduled interactions with a patient. Then after you're done with the 2 forms, you will be handing them in. You'll basically be graded on accuracy and completeness of the forms. Just as a side note, some students aren't sure of what the difference is between a medication list that is regular versus detailed. A regular medication list would just be plain English, simple medication list. This is what you're taking. This is how you take it. So for example, lisinopril 10 milligrams daily, take it every day at 8 a.m. Detailed medication list would include more complex regimens, such as where the dose, day, or timing is more critical. So, for example, there are certain days of the week where you take different medications, you're taking things at multiple different times of day, so not just straightforward and simple. So that's all for Transitions of Care 1. So you can review both forms that you'll be provided in class. You don't need to print those. You can review the ASHP APHA best practices and review the class plan prior to coming in, either on February 20th or February 27th, again, depending on your group number. Make sure to wear professional dress and look back closer to time to find the student-specific schedule. Again, as always, make sure you email me if you have any questions. If I'm not there, the facilitator will be Dr. Desai, and you can ask him any questions while you're in the room. Thank you.